Erectile dysfunction has a number of different causes. Roughly 70% of them, however, are often related to vascular disease, and that's tied into other medical problems such as hypertension and hyperlipidemia, diabetes in particular. And certainly there are medical options such as your, what we call the Pde5 inhibitors, medicines like your Viagras and your Levitras. And those are great, but sometimes they're not enough. And so we have to take further steps to increase blood flow to that area for things to work. And so we've got medications that we could administer that are more targeted for the blood vessels in that area. And those medicines are sometimes placed intraurethral or injected directly into the erectile chambers. And if those fail, we've got surgery where we can actually replace the inner workings of the erectile process with hydraulics that do much the same job. There are various levels of people that treat erectile dysfunction. Certainly a lot of primary care doctors can treat minor degrees of it. There are urologists that are very comfortable with treating with some of the other medical options such as injections or the urethral suppositories. When it gets to prosthetics, you really want somebody that has a lot of experience with that. You want somebody that's doing multiple implants a year, not somebody that does one or two a year. It's a highly specialized subspecialty really within urology for people to do these and do these well. I treat a lot of erectile dysfunction in my practice. And what we found is that there are a lot of people that are seeking care for that and not seeing urologists. And I think that's fine for the initial treatment of that. However, there are surgical options for some patients that they would not be able to explore without seeing a urologist. There are a number of places where people seek men's health. They tend to just work on low testosterone and medical management of erectile dysfunction. We're seeking to not only tackle ED and low testosterone, but also to look at the broader spectrum of how they fit into overall male health.